next 20 minutes, we will have time to have Q&A with all the members of ISAM Board of Directors. I realized that Kathleen Brady with us today. Kathleen, are you here with us right now? And Mark was not able to stay. He had to leave, but I'm not sure if Kathleen was able to make it to the end of the meeting. But I'm happy that we have colleagues and collaborators here from ISAM, and we are going to open the panel for discussions and questions, and we'll definitely be happy to have your feedback and potentials for interactions. And I'm seeing already colleagues from different parts of the world. I was seeing Steve from ISAM. Steve, are you still with us?
Yes, I'm here.
Steve, do you want to introduce yourself?
Yes, hello everybody. My name is Steve Taylor. I am a psychiatrist by training with subspecialty training in child and adolescent psychiatry and addiction psychiatry, and also board certification in addiction psychiatry and addiction medicine, which here in the States, those are two separate boards. I am also 15 years experienced or 16 years experienced in sports psychiatry, having been the director of the drug testing and drug treatment program for the National Basketball Association here in the States for the last 16 years. I have been a member of the American Society of Addiction Medicine now for well over 20 years, and have had the opportunity to be mentored and helped in my career and in my involvement in ISAM by some of the members of this call, such as Dr. Greg Bunt and Dr. Kelly Clark. And yet this is the first opportunity I've had to join an ISAM meeting and participate with all of you. And it is really a great honor and a great pleasure for me to have been a part of this meeting. Thank you all very much.
Thank you very much, Steve, for joining us. And I know that you will have the next ISAM meeting next week, actually in Washington, DC, and we all look forward to that meeting. And there are lots of ongoing discussions in terms of the collaboration between ISAM and ISAM. And ISAM is one of the affiliated societies to ISAM. And we are hopeful to have more engagement and collaboration and kind of joint activities with ISAM. And I already see Dave Martel from CSAM as well. Dave, do you want to introduce yourself?
Good day, everyone. I'm Dave Martel. I'm the representative here, one of the representatives here from Canada. It's my privilege to come to this group. It's wonderful to share this experience. I see a group like this as being very powerful globally to help maybe bring some consensus to treatment and training. I like that we share data, that we share experience. I think we have an opportunity to do some advocacy on drug policy, especially in places where drug policy is lacking or potentially harmful. But mostly, I like this as a social group. I think we're all doing the same work. We're being our heart and our compassion to the group, and we're a society of friends. And I look forward to making friendships with some of you, hopefully in Washington. I'll be in Washington myself soon. So it's my privilege to be permitted to be part of this group and to make a contribution. Thank you for inviting me.
Thank you very much, Dave, for joining us. And CSAM has always been one of the major pillars of ISAM activities, and CSAM is one of the kind of affiliated societies to ISAM. We are looking forward to extending our collaborations with CSAM as well. And I realize that we already have people from AAAP here as well. I'm not sure if I can see Carol Weiss. Carol, do you want to kind of talk a little bit, or your other colleagues from AAAP?
I have some background noise here, so hopefully you'll be able to hear me. But we're very excited to be AAAP affiliate members, and I'm a member. I'll also be at ISAM in DC next week. But we're very excited about the joint collaborations that we can do in terms of consistency of training, both among. We're very interested in developing higher standards and consistency of training in substance abuse among medical schools, psychiatry residencies, and even addiction fellowships. And it's very much parallel to the training that ISAM is developing internationally. We also have a network of experts, the ORN network, and that is something that would be wonderful to be able to be linked to your expert network. So I'm just very excited about doing parallel work, collaborating, and being a part of ISAM. And see
Thank
you
you very
in
much.
Marrakesh.
Absolutely, we are looking forward to see you. And we had lots of really good experiences in Malta together as well, discussing about the things that are happening in the global level. And we are looking forward to see each other in Marrakesh as well. So, and we already have some of the ISAM board members. Yasser is already with us. And Alex, I mean, the floor is yours. So you kind of people have questions and we can discuss about the potentials in the future. Alex, please.
Yeah, well, the floor is ours. Yeah, yeah. But in a way, I think sort of, it's really conversations, narratives, communication is essential. This is not rocket science. We all knew each other somehow, somewhere, met in conferences, and felt that we were connecting. And this is the power of connection. Talking about conference, talking about having joint symposium. Carol was asking us around someone in the UK working in one field, and we connected with each other. It's the process of a journey, not the outcome or the output or the destination. I think it's the process, the relationships that we start having, and I think that's amazing. Certainly, it supports me as a clinical academic in the day-to-day, that I know I'm not the only person who's struggling with, clinical issues or other issues in addiction.
Awesome.
And just as a reminder, by the way, next year, the ISAM conference is going to be in Malaysia, in Kuala Lumpur, the year after in Hamburg. We don't have any, but we have interest for 2026 from VVGN, and then after that we have conferences in Australia, and I'm going to miss a couple others in Switzerland, and we have interest of regional conferences as well in Singapore and other places. So I think the formula is good, is empowering people and empowering organizations to do these things.
Awesome. And we have the kind of raise hand option if you want to kind of contribute and present what you are doing and discuss, that we will definitely be happy to have you in the discussion. So please use the raise hand option on the bottom line in the space to present what you are doing. I saw Basma, who is originally from Iraq, and I know that Basma was trying to put together people in Iraq to develop a national society of addiction medicine in Iraq. Basma, do you want to say hello?
Hi, hello. It's wonderful to meeting you all, Alex, Ahmed, and all the colleagues. It's a great meeting, and I already got an insight and information about the global only by attending this meeting, which is the wonderful outcome of the society. So thank you so much, Ahmed, for your time and for everyone.
Thank you very much, Basma, for joining us. And she's doing a really nice job putting Iraqi colleagues together and kind of helping them to develop the Iraqi Society for Addiction Medicine. And we are hopeful to see the results really soon. And this is the same. I mean, we are working with people and colleagues in Afghanistan, helping them to reshape, because they had major issues in Afghanistan, but right now they are reshaping their society in Afghanistan. Hopefully that would be another step that we are trying to do together. We already have Yasser. Are you with us? Do you want to have a few words? Yasser has us.
Hamid, I would also give a shout out to Bal. Bal who's in Iceland. And can you say a few words? Because Iceland was really the host of the first major ISAM conference back in 2002. Bal?
Hi, everyone. This has been a great couple of hours with you. Yes, when we hosted the ISAM conference, it was 2002, and it was the anniversary of SAO, our society. And now in 2027, it's going to be our next big anniversary, 50 years. And but I understand that the year is taken for the conference for ISAM. But hopefully we can give at least host a regional conference 1 year. That would be wonderful. And I would be happy to show you around our treatment facilities and options. And we are trying to recruit doctors. We're so few in Iceland, and but we're doing a lot of things for addiction. But there are not very many of us doing addiction medicine, unfortunately.
Yeah, Val, it's great to have you here. And Val is going to run the London Marathon next week. So that is amazing. Hopefully, those who are interested to run, we can join together in Marrakesh and kind of find places to run together in Marrakesh. And Val is going to lead us in terms of the kind of running experiences. But it's amazing to have colleagues from different experiences. The board is meeting is open for further discussions. Yasser, are you with us now? Can you hear us?
Yes, I'm with you. I would like to. I'm very excited by this meeting. It's amazing to have so many people involved from around the world, so many ideas and so many powerful connection. So we can go many steps further with such a connection and the network. And congratulations for all of the people who came today and all their collaborator, and congratulations to you, Hamed, and the team you are working with for bringing us together. So thank you very much. I'm very excited for the next steps.
Awesome, thank you very much. We had Ali Farhoudi and Omid Masaf from Iran, Iranian Society for Addiction Medicine. I'm not sure if they can kind of talk for a few words and share their experiences as well. And I can also see Xiaoqiu from China as well. Can you say a few words here?
I was here, from China. I'm Xiaoqiu from China. And I'm very happy and very, I think I just hear all things we discussed, and I think the cooperation is very, very important. Actually, we also want to give more contribution to ISAM, if some possible, and some possible. So if some chance they help me, I can do more work for ISAM. Thank you.
Thank you. And we have Rama from Qatar. Rama, do you want to say a few words?
Yeah, thank you, Hamid, for the opportunity. It's kind of inspiring meeting for me. That's the first time for me to join such a wonderful event. And I think I became more excited to look for people for collaboration. I work in Qatar I'm a director of clinical and research in Nofor Rehabilitation Center in Qatar. It's actually the main center for treating addiction within Qatar. But again, this is a very amazing opportunity. We hope that we can do that. We don't have an association, but we are actually very interested to collaborate as an organization, which is also kind of governmental supported, to be also part of this movement, let's say, and collaborate in that perspective. Qatar is small, but we've been working with very high level of evidence-based and national guidelines. So I think also the data from our side and being a part of that universal collaboration and addition of data gathering is also a thing that we're completely interested in. So very interested also to see the Arabic speaking people, Yasser and other people who are coming from these regions, in which we're kind of less represented than others. So I'm kind of jealous. So hopefully we'll be a more productive part also in everything happening here.
Awesome.
I'm just wondering, how can we have this contact, because we don't have a representative of a region, and again, we're not we don't have an association or I think to catch up with ISAM activities. So can you please advise?
We are in the process of kind of working with different applicants. We already have some like 6 applicants from North Africa and also from West Asia, and I'm hopeful that within the next, 2-3 months, we will kind of define who is going to be the regional representatives. But meanwhile, you can still be connected to the ISAM community. So I would highly encourage you to send an email to Alex and start the communications for the affiliation process, and we'll definitely be happy to support that process.
That's good to hear. Thank you.
And equally, no one is stopping anyone to become individual members. And when you look at the membership, it is not only for physicians, doctors. Students are free to become members for ISAM, and also, nurses, psychologists, and other allied professionals are welcome to become ISAM members. But what's important is that when you become a member, you receive the fortnightly, what we call ISAM bites, and that shows all the activities and other things that are happening with our stakeholders that I mentioned earlier. That we have a memorandum of understanding. So there is that process going on, which I think would allow you and others in Qatar to be aware of the different activities. And one thing that I'm thinking we haven't even mentioned here is the ISAM Next. So there's a group of about 40-60 individuals who are, in traditional terms, used to be called the young investigators, but essentially they are clinicians younger than me and younger than Hamid. But in essence, they've just started to become addiction medicine specialists. Some are medical students aspiring to go into addiction. And there's a whole group of activities. I see Beatrice here and others who are leading specific thematic projects within the ISAM Next. So you get to know about not just about the regional council, but about the interest groups, the education training committee, many other things that are happening as well.
Thank you, Alex. The part I liked best saying young, but I'm not young. I'm working. I'm an ISAM board. I'm an ISAM member, and we have a lot of them in our institute.
Good.
But the question I was asking about actually to present the national aspects within Qatar.
Send me a letter. We can start the process.
I wanted to commend Alex for his initiative in really developing the next generation, and it's been so important. And thank you, Alex, for that. I also want to recognize Ben Vista, our good friend from Philippines, and ask if Ben Vista can say a couple of words.
Hello, everyone. Hello from the Philippines. Well, we're really proud to say that Dr. Bunt's visit in 2019 has actually yielded a lot of good stuff. We're prepared already to graduate our first fellow in addiction medicine at the University of the Philippines, Philippine General Hospital. And I think he's here on the call. And we already have 3 other fellows in addiction medicine that are entering into the first year. So thank you, Greg, for all the inspiration, and we continue.
Thank you, Ben.
Members of ISAM.
Thank you very much. I was going to ask also Harry from Indonesia to just say, I'm conscious of time, but Harry, just a few words.
Yeah, thank you, Hamid. Yeah, good evening from Indonesia, everyone. I'm Harry. I'm from Indonesian Society of Addiction Medicine. Actually, from Indonesia, Indonesian Psychiatrists Association, also affiliate member of ISAM, and I have been exposed to ISAM since 2013 when I had attended the ISAM conference in Malaysia, Kuala Lumpur. So it's very interesting 10 years, and we hope also like cooperation and other maybe project that we can collaborate. Thank you.
Thank you very much, Harry. And I'm conscious of time that we are at the end of the session. I already see lots of other colleagues from other parts of the world. I would like to thank them for joining us. And the last words are for Alex, our president. And I should just thank Alex for his kind of impressive supports all these years. And we are looking forward to kind of see him in person in Marrakesh. Alex.
Thank you, Hamed. And in a way, you know, again, going back to the values, I think these last 2.5 hours were a testament of that. But, you know, it's the energy that has been created. And I'm pretty sure, Hamed, you're going to receive several emails around, you know, how to do things and how to get in touch with things, which is great. This is, you know, why these meetings happen. In spite of the challenges that we have globally, in spite of the difficulties personally or professionally, we all share a common theme and a common, issue around this. Not only do we need to be more competent or encourage other people to be more competent, but also we want to deliver a good service to our populations who are highly stigmatized, and that's the reality of it all. Another thing is, going back, is this is not about drug use, it's about drug, alcohol, non-pharmacological addictions. And we encourage people who might think they have a silly idea, might think they, through their interaction with patients, etc., they realize that some elements are under-researched or under-trained. Please share these with us. You never know. Other people might be thinking about it. And we have these interest groups, the behavior interest groups, practice policy, spirituality interest groups, neuroscience interest groups, and that's the vehicle within which, you know, we can develop things that are common known, you know, such as through Delphi or consensus, but also others that are emerging, and and that was seen very much as a quite a strength during COVID, for example, where we joined forces and we managed to support clinicians. Last but not least, I think this is more a request to all of you, is that ISAM is not this rich, wonderful organization support. It's made up of volunteers. And we appreciate people who volunteered for quite a number of years. And I'm going back to the slide that Hamed has put in for Greg as a senior advisor. Greg has been with us for a long, long time as president, as in different categories. And we have reached a situation where we are gaining from experience of individuals who've been through, you know, global international organization and its governance. And so the next step for the regional council, for example, is the request from the board to think about having a group of senior advisors. Senior sounds very old. A group of advisors who would be able to support this part of the organization. And I can only, you know, ask you to keep safe and enjoy life.
Thank you very much. Have a nice day, everybody.
Thank you very much.
Thank you.